and welcome to our video series for Mental Health Month, where we talk to experts and people with lived experience about their strategies and tips for better mental health. Today, we're talking resilience, and joining me is Dr Jaelea Skehan, psychologist and Director of Everymind, an institute based in Newcastle dedicated to the prevention of mental ill health and suicide. Jaelea, welcome.
Great to be here with you.
Thanks. And can you tell us a little bit about yourself and what got you started in the mental health space?
Well, I started with psychology. I've then studied and worked a lot in population health and really thinking about how we get strategies that promote mental health and wellbeing, things we can do to prevent the onset and the severity of mental health concerns, and also what we can do to prevent and respond more effectively to suicide across those domains of everyday life. So at work, at school, in our families and in our communities. And so applying kind of what we know about mental health to those everyday environments.
And we hear a lot about resilience when it comes to mental health. What is resilience and how can we work on becoming more resilient?
Look, there's a range of different definitions of resilience, but often people talk about it as being having the tools to either bounce back, or I like to say bounce forward from the ups and downs and challenges that we might experience in everyday life. And so it's a part of mental health and wellbeing, and so it's a part of being able to work through or live through challenging times, to be able to have the tools to respond for yourself. But we also know it's a bit of a dirty term sometimes, particularly in health professions and particularly when I'm talking to doctors and others, because they often think that resilience is only something that we put the focus on the individual, that if just the individual was resilient enough, their mental health and wellbeing would be better. But I like a broader concept of resilience, which is what tools does the individual have and also what environments are they in, and are both of those resilient? So even those of us who are having a really tough time can bounce back or bounce forward or recover from or work through really challenging times if our environment's got some give in it. I think about our environments as a trampoline. How much can it give? How much flexibility does it have?
And then the emphasis is a lot more on who's around you and the organisation supporting you. And you mentioned healthcare workers in particular are a bit of a special case. They're a cohort of people who really are expected to turn up no matter what, in the worst cases sometimes. And we've all seen that during COVID, particularly here at New South Wales Health Pathology. And people are counting on them to be there. What would be your advice to people who are feeling that burnout, who are feeling a bit overwhelmed?
I think it's really easy for those of us who provide care to others to forget about the care for self. And I'll probably talk about this in two ways. I think there are things that we can do for ourselves, but I also think individuals with inside health systems, there are things that we can do for others, regardless of what our role is, and that changes depending on how sort of far up the food chain we are in the health system. But in terms of things for ourselves, like we bring ourselves to work, and generally speaking, having purposeful work to do is good for our mental health. So I have to remind myself about that from time to time. But having a job and having purposeful activity is generally good for us. But there's other things we need, like as you know, a car needs petrol and oil and good tyres to get from A to B. As human beings, we really do require some basics, and they're things that we can let go when we're really busy, and they're things that we can let go when we're in the helping profession. So I'm talking about things like getting enough sleep and rest. Really hard if you're on rosters, or if you're working longer hours, or you're also parenting children or looking after other loved ones, but really factoring in sleep and rest as being critical for our mental health and wellbeing. Getting nutritious food and getting some movement, activity or exercise, whatever you're capable of, into our everyday lives, because our physical health and our mental health are really intertwined and linked. And so when we feel well, we often can operate in a better way. But also we're social beings, and so making sure we've got good connections and good social connections outside of work, but also inside of work. And I know that can be difficult for people who are in more isolated roles or perhaps working on their own, but we do know that people do better and thrive at work when they have those meaningful connections. And so how can we foster those both outside of the workplace and inside of the workplace? And I think importantly, speak up early if you're having challenges or concerns. And that's the thing that can often be difficult for us to identify in ourselves when we're working in that helping profession, where we're often thinking about other people first. And so how can we identify when we're not quite travelling so well, and what's the earliest point we can ask for some additional support?
Yeah, and people often worry about this is going to impact my relationship with colleagues if I admit that I'm struggling, and all those sort of considerations then come into play, don't they?
Yeah, and it's also much earlier than that as well. And so I don't know how to do a task. I mean, I'm not sure how many people have lost sleep or been really impacted by just not having the right information about how to do a particular part of their job. And we often dismiss that, and we think mental health is about these really big things that happen, but actually it's a lot about we know how to do our job, we got the right supports around us and the right amount of hours and resources to get it done. They are fundamentals to keep us all healthy and well at work. And so speaking up early about things in the job that aren't going well for people, but also we bring ourselves to work. And so I don't expect that, people who work with me and alongside of me are going to be at their best every single day, because things are going on for people outside of work and inside of work.
And in terms of strategies that you use in your life, have you got any tips for us in terms of how you keep things on track when maybe life does get a bit busy and you can tell that you're not at your best?
I think I've got better at this as I've got older. So I think I'd probably like to go back and talk to my younger self about work-life boundaries. I think there's something about working in a helping profession and being early in your career that you find this energy for work. But I wish I'd learnt some of those tips a bit earlier. So if some of you are a bit younger than me, perhaps I can talk to you rather than talk to my younger self. But things I do now, I'm much better at setting boundaries between life and work, and I prefer the work term boundaries than balance, because I think at any one time, the work-life balance can look a little bit different, but boundaries. So for me, sleep's really important to me. I'm not a great sleeper. It's something I have to work at. So nighttime work is off for me. So I'm a morning person. I get up earlier if I have, more intense work times, but I never work in the evening, because if I work in the evening, my sleep goes. And once my sleep goes, my effectiveness as a family member and as a work colleague is not great. So that's been a really big and fundamental one for me. I like to add in social connections. So I'm actually someone that gets invigorated by the right types of social connections. I know others need quiet time. I tend to thrive off kind of social connections, and so catching up with friends and family. And I try and add in kind of exercise and really, focus on the things that kind of do well for me. But I think also the other thing I'd say to people is I'm much more planned about things now than I used to be. Like, I know that just doesn't happen by accident or by osmosis. So when I see a busy period at work coming up, and September and October are the 2 months for us that seem to, escalate in terms of activities and meetings and things we need to be at, is I really think about priorities, and I try and reprioritise for myself and my team. What can we say no to? What can somebody else help with? What's non-essential, so that if I get unwell, we could cancel it or we could reschedule that, and being okay at doing that. And I think that sometimes comes with age. And so if you're in a leadership position in your workplace, or a person that can give some advice to others, really helping others to really set those priorities.
Yeah, and I suppose you mentioned the ability to say no, and I suppose it's about being able to communicate that and knowing where your limits are or your boundaries, so that you're prepared for that conversation if it has to happen.
And obviously I work in an office-based Monday to Friday role, and not everybody gets to work in those roles. And so for some people, rosters and other, patterns might dictate, what social activity looks like and what sleep looks like, but actually making sure you've got a plan for yourself that makes sense. I guess the other thing what I'd say is I've actually got better as I've gone along at not only looking after my own mental health, but looking after the mental health of the people in my team. And so anyone that might be watching or listening that is a supervisor or a leader or a manager of some kind, it's not just your job to encourage people to look after their own mental health, but it's actually our job to look at the potholes in the road, right? That's our job, is to make sure that people are working in a safe and supportive environment. And so what are the hazards or the things to pay attention to with workloads, with the way in which our teams interact, and the things that you can really do to foster a great culture where people are well at work and also where they're more enabled to be mentally healthy.
And just finally, Jaelea, I know one of the things that Everymind does do a lot in the communication space is talking about the language that we use around mental health and the sorts of throwaway lines that we might use. How important is the language we use when we're speaking to each other about mental health?
Look, I think it's fundamentally important, but it also shouldn't be a conversation stopper. So I've got two sides of this. One, I say to people, if you want to have a conversation with someone about mental health and wellbeing or about mental illness or their experience, actually starting the conversation and having the conversation in a compassionate and open and curious way is really important. And if you being worried about what words you use gets in the way of that conversation, then I say worry less about the words and worry more about having a really open and authentic conversation. But if you're communicating more broadly or you're not really thought about the kind of language you use, language implies underlying beliefs, and underlying beliefs contribute to stigma, and stigma contributes to discrimination in our workplace. And you know, almost half of us will have an experience of a mental health concern at some point in our lives. Many of us are providing care and support to people in our homes, whether they're children, whether they're partners, whether they're older parents who have concerns. And I think it's all of us in some way affected by mental health concerns, mental illness. And I think it's important for people to really pay attention to what they say and how they say it. And there is no closed door behind the scenes conversation that you can have, because it's actually not about them, it's actually about us and all of us. So if people want some tips, they can go to some of our resources. Mindframe website's now got some new Our Words Matter guidance documents, which is about, you know, what sorts of words are more preferable and how can you have these conversations, not just in media and in public environments, but actually through our health service. It's really important what we say.
Well, thank you so much for joining us today to talk us through resilience and what it means to our workforce. Thanks, Jaelea.
Great. It's great to be with you.